I want to take a minute to talk about sleep apnea. Why would a dentist talk about sleep apnea? That's probably what most people think, because they don't realize how common it is for a dentist to actually be the one that can help you with that. If you wake up feeling really tired or fatigued every morning, if your loved one who sleeps next to you reports that you choke or gasp or cough during the middle of the night, you may have sleep apnea. It's actually really, really common, and a lot of people are suffering through it, not knowing that they're struggling through the night to breathe appropriately, and so they wake up just exhausted because your body is really struggling to survive while you're asleep. And so it's not just for the big middle-aged guy, which is what we kind of stereotypically think of as a CPAP patient or a sleep apnea patient, but actually very slim women, even younger in their 30s or 20s and 30s, that's one of the main risk groups. You know, there's a ton of women going through life struggling with sleep apnea that have no idea, and they really don't think to ask or look into it because they don't think of themselves as a likely demographic to suffer from it. So one of the things that we can do is we give you this little device. It's an amazing thing. It's called a WatchPat. And it won some awards a couple years ago for being one of the best new medical technologies out there. And I've talked to some sleep physicians, and they say that it gives you pretty much all the same detailed information that you get from doing one of the sleep studies at an actual hospital or sleep center, which is great because if you ever looked into it, going to do a sleep center study can be a little awkward. You're sleeping in this foreign place with a bunch of wires connected to you. There's some guy sitting there kind of watching you sleep, checking monitors the whole time. I personally don't understand how that can possibly simulate a normal night for you, because that sounds like a terrible evening to me. But what we can do is we send home this little device that you can wear in the comfort of your own home, and we do get a really, really accurate reading of how you're breathing at night. It gives us a ton of information so that we can sit down together, talk about how well you breathe. Are you just a snorer? Do you have mild, moderate, or severe sleep apnea? And there are folks that need a CPAP, and a CPAP is it looks like a little fighter pilot's mask that it's a continuous positive airway pressure where it's blasting air down your throat the whole night to make sure that you're getting plenty of oxygen. That's great and very helpful, but as a general rule, people hate them. It's very awkward to sleep with them. They have a mixed efficacy because in the middle of the night people take them off because they're uncomfortable. It's hard to move around. It's a very claustrophobic feeling for some folks. So what a dentist can do to help with that is if you have the correct level of sleep apnea, which is usually somewhere in the heavy snoring to about moderate range, we can make a device that helps posture your jaw forward. It's like having two bite guards in at the same time, an upper bite guard and a lower bite guard, that helps posture your jaw forward, that maintains that open airway so that you can sleep well and actually breathe throughout the night and stay healthy, because sleep apnea puts an enormous tax on your body. It beats up your insides. It's really wearing you out. You're aging faster inside than you are outside, and it makes going through life tough, because if you're waking up exhausted every day, it's a hard thing to get through the day as a productive member of society, you know? So if you have any of these symptoms, or if you've been told you have sleep apnea, if you have a CPAP and struggle with it, come chat with us, because there's likely something we can offer that can be majorly life-changing. So I look forward to speaking with you, and let me know how I can help.